As you listen to this podcast, I understand there's the possibility that you're driving or walking, so you may not be able to write something down, but I want you to come back later and listen to this open because I'm going to give you a phone number right now. And this phone number is your ticket to a smile, guaranteed. It's a hotline that students from an elementary school created to provide words of encouragement and life advice to those who need it. It might be the sweetest thing I've ever heard. I plan on calling this number every day. I'm not telling you any more than that. Just dial this number when you get the chance. 707-873-7862. This is not a prank. I'm not trying to rickroll you. I'm telling you that this phone number is your ticket to feeling better. Again, the phone number is 707-873-7862. Promise me you'll call the number. Pinky promise. I'm going to hold you to it.
Hello and welcome to another episode of Podfulness. Let's get started.
Good morning, good afternoon, good evening. You see, I don't know what I'm supposed to say because you could be listening to this at 3 in the afternoon or 3 in the morning. So there must be a way to greet people on podcasts that aren't specific to a time of the day or night. I suppose I should just say good. All right. Well, good, everyone, and welcome to Podfulness. We have a special guest today. Every guest is special. But today's is extra special because he is the son of someone I went to high school with. So this is the first time I'm interviewing a child of a friend. So that's pretty cool. His name is AJ Brougham. He is a med student. We're going to talk about that. We've got a fun game that has to do with medical treatments of bygone days. And thank goodness we no longer use those treatments. And we're going to talk about his favorite podcast, which is the Peter Attia Drive Podcast. So let's not wait any longer. Let's get to our guest. Are you ready, AJ?
Yes, I'm ready.
That was really his voice. He's really ready. All right, let's get to it. Is there anything you want me to tell you about your mom? What she was like in high school?
I always get bits and pieces about my mom as I get older, so I will take anything I can get. It paints a more complete picture of my mother.
So AJ Brougham is our guest. Your mom's last name is Dodely, which was the greatest last name of anybody I ever knew in high school. And so let me tell you a little bit about your mom, okay?
Sure.
So this is the first time that I've had a child of a classmate of mine on the podcast, which is cool. So she was always an adult. Like even in middle school, she was very mature. She was fun, but she was mature, and she's extremely talented. She probably sings a lot around the house.
Always.
She's an actress, so she's probably very dramatic.
To say the least.
She can't be, but she was very well liked. Like everybody adored her. She was warm, but above all, she was a very kind person. And so I don't know if you've ever had friends of your mom tell you that, oh, your mom was really kind in high school, but it's totally true.
Everyone tells me that they love my mom. Whether or not they first met her, I've known her for years. She is very well received all around.
That's right. Okay, well, enough about your mom. This podcast, really, we're focusing on you, okay, AJ? You were born and raised in what town?
In Evansville, Indiana, southern Indiana.
So for people who don't know Evansville, tell them a little bit about what life is like in the Ville.
It's I don't want to say small town life, but I mean like over 100,000, but it kind of feels like that. The best way I can describe Evansville. So Evansville, Indiana is shaped like a boot. We're pretty much in like the tip of the boot. Mm-hmm. And Evansville is like that barrier between y'all and you all. We're 5 minutes from Kentucky where it's completely y'all. And then like, what is it, like 3 hours from Indianapolis where it's pretty much you all. So we're like that transition point. So there's a lot of IU fans, a lot of Kentucky fans in that area, and nice little Catholic community down there. So it's large, but everyone kind of knows everyone, especially if like you're in specific pockets of the town.
I always feel like Evansville is the forgotten town of Indiana because it is so far. Now, fortunately, there's an interstate now that connects Indianapolis to Evansville, but it's in a different time zone.
Yep.
Right? Different weather systems.
Yep.
like you said, it's a lot of Kentucky fans. And so I always feel like Evansville's forgotten, but you are part of Indiana.
Yeah, it's weird. It's weird. Like, I mean, there are aspects of like Western Kentucky in Evansville, but also like the rest of the Midwest in Indianapolis as well. It's a weird hodgepodge.
Now, what were you like as a kid? What were you into down there in Evansville?
I was kind of a quiet kid. I was interested in everything. Basic ADHD kid. I mean, I grew up playing soccer, and then I got into guitar later on, and then I was like soccer and theater geek in high school. So I had pretty wide ranging interests. I was all
Right.
over the place.
Right.
Yeah.
Now you're wearing a shirt. No one can see it, of course, but Indiana University School of Medicine. So you are a med student, right?
I'm a medical student. At the end of my third year right now.
And so what does that mean for people who don't know how med school works?
Yeah, so basically, all American medical schools, it's 4 years long, and it's broken up into 2 and 2 years. So the first 2 years is what's called pre-clinicals. That's basically like an extension of college. So like you're doing book work, you're learning about basic sciences,
Mm-hmm.
learning about the different organ systems and whatnot. Basically trying to pile as much information as you can into your brain within a 2 year span. So it's like doing 4 years worth of information in about like a year and a half.
Does
It's
it feel
really,
overwhelming?
oh yeah, it's overwhelming. Like
Is it all interesting though?
no. I've got hard opinions about the medical school education system.
Yeah,
You could shave off a year and it'd still be fine. You could shave off maybe like a quarter of the curriculum, it'd still be fine. But it just is
of
what it
course.
is. And like,
Of-
yeah, you got to grind it out.
Do you have a good feeling of where you want to focus?
Right now, I'm wanting to go into internal medicine residency. Like I jokingly say, like, all right, like imagine like I am going to delay my choice another 3 years, and like internal medicine is basically anything that ends in ology. So think like cardiology, pulmonology, nephrology, minus dermatology, of course, but
Right.
that area. So basically, um, above the waist and below the neck is what I'm going to be working with.
Above the waist and below the neck.
Yeah, yeah.
Okay, that's a good way to look at it. So
Yeah.
how are you with blood? And have you always been okay with it? I'm assuming you're okay with blood.
Yeah, I've always been okay. The first time I saw surgery, I was 18 years old, and it was like a total knee replacement. And like it's one of the goriest surgeries you
Oh,
can see.
really?
Yeah. It's like a 70-year-old lady. They're like cutting out the kneecap and like that area basically, and to get the implant in place, you have to hammer it in. So like they pull up the lady's leg, you hammer in the
Oh,
piece into the leg. There's bone marrow flying everywhere. There's shards flying everywhere. Not bloody in that scenario, but I have seen some bloody surgeries before. It's intense, and so like I've been exposed to that for the better part of 6, almost 7 years now. So like
wow.
I'm kind of used to it.
So nothing makes you squeamish. You're okay with smells too, like weird smells that might happen in the operating room?
Uh, Smells can sometimes get me,
Mm-hmm.
but most everything I'm pretty used to. There's not anything so far that's made me really squeamish.
Yeah.
The things that make me the most squeamish, surprisingly, is facial surgery.
Now, why is that?
Yeah, so normally in surgery, like you have like this blue sterile covering that covers up most of the body, and the only piece of skin that's exposed is the area that you're working on.
Okay.
And so like legs are covered, arms are covered, face is covered as well. But for facial surgery, you gotta see the face.
Yeah.
And so I was watching a rhinoplasty, so basically a nose job,
Mm.
and again, same thing. Like they're hammering away at the bone pieces you need to remove. So it's it made me a little nauseous because again, it put like a face to the
Yeah,
person,
because
which is
it's an actual person you're working
it's
on,
an actual
not a body
person.
part.
Yeah,
Right.
yeah. So you can kind of remove the body part from the person in most surgeries, but like in this scenario, there was an actual person you were kind of mangling in there.
So, so this is why kids that are listening, why you're not allowed to be in the surgical room when a parent or a loved one or a child is being operated on, right?
Yeah,
Because
no.
people would freak out, family members.
Yeah. It's really unsettling if you're not aware of what goes on. It's yeah.
Yeah. I've always heard that med school is really competitive. How come it's competitive and not collaborative? I mean, everybody has the same goal to become a doctor, right? But why is it
Right.
so
Yeah.
competitive?
Well, it's kind of changed over the years. It's kind of like in a weird in-between phase as of right now. So one part of the competitiveness comes from the fact that there's only a limited number of spots. There are more people who want to be in med school than there are spots available. So there's that aspect.
Okay.
In medical school, it used to be the fact that it was super duper competitive because there were grades and rankings within the class. And so you're going to probably want to do everything you can to get like a little extra edge to be higher up than the next person. Because again, like there's a limited number of spots for med school, there's a limited number of spots for residency positions as well. And especially so for the more competitive specialties like orthopedic surgery. I think there's like 5 possible residency spots in the state of Indiana. So it's like kind of a supply demand mismatch there. Now it's not so much the case. A lot of med schools you'll see are going to a pass-fail system within the first 2 years. And so like as long as you meet a certain threshold, you pass the class. And so that way, it's a little bit more collaborative. So you can argue whether or not like, all right, so like you're at least getting rid of the competitiveness, but it kind of makes it hard to assess competency in that sense. And you're seeing that with a lot of the big medical school exams, like the Step 1 exam went pass-fail last year. I was the first class to do it pass-fail without a letter grade. And now that pressure is being moved to Step 2, which is the exam you take at the end of your 3rd year, and that will still be scored. And so that places a lot of emphasis and focus on how well you do on that and how competitive that will make you later on.
And have you heard stories about folks that go through med school and still can't find placement anywhere, and they've had to change their whole trajectory of their career?
Mm-hmm. Oh, yeah. I've heard about that a couple times.
So they're doctors, but they can't find employment.
Yeah. So they have the MD behind their name. They've graduated school, but like to practice in most areas, you need to have like residency training, and at least that as a baseline. More often than not, like you can't graduate med school and then go straight to practicing medicine. That's not particularly kosher. You could go into consulting or like startups or something like that, but you can't practice as a physician. And yeah, there have been a couple times where I've heard of people graduating from med school, but they aren't able to get jobs and residency afterwards, and it's really, really sad.
How are you letting off steam? Is it guitar? Is it soccer? Do you have any time for that in your life?
Yeah, I mean, it's I work out whenever I can. That's really important. I read a lot. I play guitar whenever I can.
Who are your favorite guitarists or bands?
I grew up listening to a lot of John Mayer bands.
Yeah.
My cousins got me into Dave Matthews Band whenever I was in high school, so I'm a diehard Dave fan. Chili Peppers were a big one. More recently, I've kind of been on kind of like a new age country bluegrass kick. So
Nice.
Tyler Childers is a big one. Sturgill Simpson is one of my favorite artists of all time. I'll preach from the mountaintops that like, hey, everyone needs to get into Sturgill.
So let's talk about soccer. Do you still play soccer like with intramurals or?
I do pick up games. I did travel soccer from the time I was 9 until I was 16. So like traveling around the Midwest with my team from Evansville, and then I did so I stopped at 16, then 4 years varsity soccer in high school. So call that 13 to how old? 14 to 18 in high school.
Were you defense or offense?
Defense
Or midfield? Defense?
I played center defense from the time I was 9 until I was 18. Yeah,
that's an important position.
Hey, nothing got past me.
I love it.
Yeah,
so
yeah.
are you into Ted Lasso then?
Oh yeah. I just watched the new episode last night.
It's so good.
It's so good.
And have you checked out Welcome to Wrexham?
No, my parents told me to watch it. I haven't had a chance to watch it yet.
It's real life Ted Lasso. It really,
yeah?
you get the same feeling after watching an episode. Yeah, it really, it's you get a warm feeling. It feels good. You don't feel sad about the world, which so many shows do. All right, so AJ, you are single.
I am.
Right? Yeah. Okay. How soon into dating someone will you let them know that you're a doctor?
I think they'll know from the get-go because it's in my dating profile.
Oh, I see.
I know. I got a picture of me in my white coat on on dating apps. So
Oh,
it's
I
just
love it. Are your arms
right.
folded and do you have like a stethoscope around your neck? Like,
No,
paint the picture for me.
it's just a picture of me, my mom, my dad in my white coat, and it was the day of our white coat ceremony. And the white coat ceremony is basically the transition from the pre-clinicals to clinicals. It's basically so like you're about to go in the hospital for training. Here is your white coat that you've had for the past 2 years, but now it's like official. You can wear this now.
I love it. So you give all of this money for med school and in return they give you a white coat. Totally
No,
worth it.
no. We get a white coat at the beginning of med school, and then on stage we give them the white coat we've had for the past 2 years, and then they give it right back, but they put it on us instead.
Oh, but it's clean, right? It's not one that's covered
No,
with
I've
like
never
bodily
washed it
fluids.
once. No, it's not clean at all.
That's what I like to hear.
Yeah.
So one of your favorite podcasts happens to be a podcast that is hosted and run by a doctor.
Yes.
And we're going to get to that podcast right after this break.
Podfulness.
Whenever I see close friends or family members out in public, I always know how to greet them. It's always a hug. But sometimes I see people who are more acquaintances and not friends, and the greeting can get a little clumsy. Sometimes exchanges with minor characters in our lives require a handshake or a fist bump or even a high five. How do you know how to greet these people? Do former coworkers get handshakes? I used to play softball with this guy, so he gets a high five. This gal I know from church, so fist bump? And inevitably, this happens. He reaches out to shake hands, and you go for the high five. Or you go for the high five, and he goes for the fist bump, and you end up wrapping your hand around his fist. Awkward. That's why we should all consider the simple act of the head nod. No one gets hurt. You don't feel uncomfortable. It's not embarrassing. And most importantly, we don't have to touch each other because, quite frankly, touching is gross. And if you don't believe me, listen to episode 14 where I talk about how little men wash their hands. Listeners, if I see you out in public, no handshake, no fist bump, no high five, just a friendly head nod, and maybe even a smile. Or a wink if you're lucky. And now, back to the show. The Peter Attia Drive Podcast. This is the podcast we're going to talk about. What does the audience need to know? What's a quick synopsis of the show?
Yeah, so basically Peter Attia is a physician, and like his specialty and area of interest is into longevity medicine, basically how to increase lifespan and health span. Basically, make yourself live a comfortable and healthy life for as long as possible without deteriorating too quickly.
Wow. And is he still practicing or is he just devoting all of his time to the podcast? And
He's still practicing. He's had a very interesting arc. He's a very interesting individual, and that's kind of the appeal for the podcast for me.
right. So this every week, is it released weekly?
Released weekly.
And every week it covers a different topic related to how you can improve your health and live as long as possible, as healthy as possible, right?
Yeah, pretty much. The focus is on like all things longevity. So like he's had sleep specialists come on, he's had exercise specialists come on, nutritional, and then as well as like what is it? Like meditation, emotional, sleep stuff, all that good stuff.
Does he ever have episodes where he talks about myths or supplements out there that claim they work that don't?
Yeah, he actually has a couple episodes on what makes good medicine and what makes good science. He's a really good educator in terms of supplying people with the tools on how to navigate kind of like all the BS out there and kind of know what's what.
So where is he out of?
So he was originally based out of San Diego. He had practices both in San Diego and New York, and then he moved to Austin like at the beginning of the pandemic. So he's been Austin based for almost 2 or 3 years now, but his practice, early medicine, is remote. So like he'll go to Texas, he'll go back to California, he'll go back to New York, and then he does a lot of consulting in terms of medicine as well.
Right. Because it sounds like the topics that he covers aren't things that you would go to the doctor for, right? So this seems more lifestyle-y. Is that accurate?
Is
lifestyle-y a word? For our purposes, it is.
Lifestyle, yes. The way he would put it is Under the current medical model, no, you're not going to get what he's providing at your normal doctor. Uh, his framework is what he calls medicine 3.0. So like there's been like two renditions of medicine over the past like 150 years. Medicine 1.0 was basically like call that germ theory and basic scientific understanding. Like, hey, there are germs out there, and hey, like we probably should test these things to make sure they are actually legit. Like there are no such things as humors or whatnot. Medicine 2.0 is like what we know as data driven care. Think like 1960s, these large medical trials, and we got really good at treating acute disease. Like no one is dying of tuberculosis or
Right.
pneumonia or other stuff like that on like a day-to-day basis. Medicine 3.0, which is his stuff, like yeah, sure, it's lifestyle, but it's more focused on the individual than the population, and it's also focused on making sure like we're managing chronic stuff in addition to the acute stuff as well.
Mm-hmm. Does he ever talk about, I'm trying to think of the word, not sleep chambers, maybe it's sleep chambers, whatever it is, when people talk when they're towards the end of life, they want to be frozen and thawed out later when medicine is more evolved. Does he ever talk about that? What is that called?
Cryogenic freezing.
Cryogenic,
Like,
thank you.
Yeah. Mm-hmm.
And-
No, he's not had a guest on that yet. It's pretty much basically everything before cryogenic freezing is what he talks about.
You mentioned improving your sleep. So that's one of the episodes that I listened to.
Mhm.
Now we need to let the listeners know these are not 30-minute or 60-minute episodes. The one that I chose was 3 hours and 14 minutes. That is lengthy.
And that was a part 1 of 3. Like he talks to Dr. Matthew Walker, and he has 3 episodes, and each episode is like 1 to 3 hours each. Like they are dense podcasts.
But it held my attention the whole time.
Yeah, they're captivating.
Yeah. So Dr. Walker was talking about the stages of sleep and how to
Mhm.
improve sleep and the pros and cons of napping and, everything that you're sort of curious about, but you never really take the time to explore or ask Google, it's thoughts that come in and out of your mind and then you're busy with your life.
Yeah.
But what I found really interesting was that when he gets asked, which is more important, diet, exercise, or sleep, he said that sleep, you can't bulk sleep in there because sleep is the foundation.
Yep.
Right. And so do you remember what he said about that? Talking about Guinness World Book of Records and sleep records?
Yeah. Like it was like a max of like 10 or 11 days. And like even then, like it had problems and effects for like weeks to months to come.
Right. So
Yeah.
you can go without food for a while. You can go without
Yep.
water for a while, but sleep will wreck you
Yeah.
if you go without
yeah.
it.
Yeah, there was a story in the episode. There's I can't remember where the family was from, but there's a genetic disorder that runs in a certain family where basically they lose the capacity to sleep. And it's a slow deterioration over the course of like 2 to 3 months, and basically they die of sleep deprivation. Like for whatever reason, like whatever sleep provides, when you're deprived of it, it will kill you
Right.
in the end. Yeah.
So do you learn things on this podcast that help you with med school?
Yeah, actually, it is kind of like a secondary education to med school, because there are 2 parts I like about the podcast. One is like the basic science and application of like, so it's very, very useful. So like there's a lot about cardiovascular medicine, lipidology, stuff like that, that actually comes up in day-to-day practice whenever I'm in the hospital. So it's really informative on that as well. And then the other aspect, which I really don't think it's enough love in medicine, but like he really dives into, is like the more emotional aspect of medicine, which has been a real interesting
I like
kind of
that.
character art for his podcast for me.
Yeah. Is he an empathetic type of person? What's his personality like? What's his bedside manner?
Really compassionate.
Okay.
Surprisingly compassionate, because he is one of the most intense people I've ever like witnessed. He's one of my favorite case studies of people just to observe, because I can't comprehend the things he does.
Mm-hmm.
So yeah, so his upbringing was he's got a mechanical engineering background from Canada, then had a change of heart and wanted to go into medicine. Trained at Stanford. It was like, okay, I'm going to do general colorectal surgery. Trained at Johns Hopkins, which is like the best residency program in the world. was like, you know what, like I can't do this anymore. Was getting burnt out. Stepped away from medicine. Worked in consulting at McKinsey for a couple of years, and
Hmm.
then came back to medicine and basically started his practice as we know today. In addition, like his interests range from ultra endurance swimming, which he did back in like the early 2010s, swimming like 25 miles at a time. He
That's
races,
nuts.
yeah, it's crazy. And then what was it? He is a big F1 fan, so he races cars. He shoots bow and arrow on like hunting trips. He was in nutritional ketosis for like 2 straight years, which is no easy feat. He is an fascinating human being, but also incredibly kind. And like that's changed over the course of time because uh, yeah, the podcast is basically like an insight to a person developing emotional well-being over the course of many years. And you watch
Oh,
it,
wow. That's fascinating.
yeah, and
I like that.
that's not what the podcast kind of sells, but that's kind of what it is. It's his own. I don't want to say like personal diary, but like his own kind of personal
Hmm.
development from like being this really intense human being to kind of transitioning into a more well-rounded individual.
Help me understand how, if he is promoting longevity,
Uh-huh.
why is he getting into a Formula One car? What is he doing? It seems like that's risky behavior.
It is risky behavior, and he would probably say like you should not do risky things without balancing out the protections or whatever it is. So like he's really big on precautions and safety precautions and sports and health and in Formula One as well. Like he would say like you'd have to control as many variables as possible. And like he's not racing in like your normal like Formula One race. Like I mean like anyone would say like that's super risky. But like he's doing like your basic like low level like Austin circuits, for
Sure.
example. Yeah, yeah.
Okay. The pacing of the show, if these shows are long, he
Mhm.
has guests that come on and regular guests. What else does he do to keep, if you are self-described as having a little ADHD, how does
Uh-huh.
it keep your attention?
Well, one is actually he has fantastic show notes. Like you have to pay for the show notes, but like the show notes are worth their weight in gold.
I saw that. That looked like a college course in itself.
It is a college course in itself, but they're great. And so normally I'll like read the show notes before I watch the episode. One, to either figure out whether or not it's worth my time, and two, to kind of have like a framework on what's going on too. Normally he can keep my attention because I mean he asks good questions. He knows where to dive in, and the individuals he has on the podcast are interesting enough to like maintain my attention.
Yeah. So when you're listening, what are you doing? Because this isn't something you can just sort of listen and do other things and have conversations with people. It seems like you have to be very focused. So what are
Yep.
you doing at the time you're listening?
I'm either driving to work or I'm on a walk or at the gym. Those are the three places I normally listen to it. And if I get bored, I'll watch it on YouTube at home.
So are you like me? Do you listen to music anymore when you're at the gym, or is it mostly podcasts?
I have to force myself to listen to music at the gym because I work out better with music and I don't retain stuff as well whenever I'm lifting weights.
No, I gotcha.
Yeah.
If Peter were to invite you on the show as a guest, what would your area of expertise be? Where would you want to focus your time?
I honestly don't know. I I I feel like I don't have anything to provide. I'm just trying to imbibe all the stuff he has as
Yeah,
of right
you'll
now.
get there.
Yeah, I'm getting there. I'm still trying to figure out what my niche is.
So
Yeah.
Peter Attia podcast. Well, it's drive. Why is the word drive on there in the podcast name?
I think it has to do with his love of Formula One. I
Oh,
honestly
I
think,
see.
yeah.
It's not for your drive, but because he loves to drive. Okay. And it's available everywhere podcasts are played, right? He has no
Yep.
exclusive relationship with a certain podcast provider or anything like that.
Nope.
I assume he has commercials and sponsors, or no?
Um,
I'd be curious to know who some of those sponsors are. I can't remember if I heard a sponsor in the episode I listened
I
to.
don't. He does not normally play sponsored. I think it really is audience supported, and then I think Athletic Greens is one of the companies he invests in. I think they are like a sponsor for the podcast, but he doesn't do a lot of advertisements.
Mhm.
Yeah.
Well, AJ, it's not going to be long before you're treating patients on your own. right? You're going to be a full-blown doctor. You're going to have to diagnose patients. You're going to have to prescribe medicine, have tough conversations with patients, depending on, of course, what field you go into. But there's no question you're going to be a doctor. And right now, your mom is clapping her hands. She's so proud. So over time, though, medical treatments have evolved, thankfully, right? So you mentioned talking about medical 1.0, 2.0, 3.0. We're going to kind of go back to medical negative 3.0. Okay. Sure. In a little game that I'm calling Diagnosis Insanity.
Podfulness.
So I will describe a medical scenario and you tell me how it was treated back in the day. So all of these medical practices were real.
Yep.
Now, if you get them all right, I will pay for your med school. If you get any incorrect, the deal is off. And if you do end up getting them all right, the deal is still off.
Right.
Okay. Okay, so here we go. Number one, in the late 19th century, what was believed to be the perfect substitute for blood and the fatty oil qualities believed to become white blood cells?
Ooh.
They did transfusions in the late 19th century. That was not with blood, but with what?
Oh, interesting.
Because they believed it had the same fatty qualities that blood had. Think crazy. You have to think crazy.
I am going to guess either petroleum or olive oil.
Petroleum is such a great guess. The answer is milk. They did milk transfusions, right?
Yep.
Many resulted in death.
Yeah.
Right. In one instance, an injection of milk was put into the patient and the pulse stopped immediately. And they resurrected that patient with morphine and whiskey.
Oh my goodness.
Yeah, and the patient died 10 days later.
Yeah.
Okay.
Victorian medicine was crazy.
Okay, so here we go. Number two. At one time, this was promoted as a cure for asthma. Just think insanity. A patient comes into you and says, I'm suffering from asthma. And you say, here you go. This is what you need to do.
My gut instinct is always to say bloodletting because that seemed to be the
they were into bloodletting, weren't they?
Yeah, they were really into bloodletting. We'll go with a glass of milk.
Oh, you're sticking with milk.
With milk.
The answer is, believe it or not, promoted as a cure for asthma, cigarettes.
Oh, no kidding.
It's common knowledge now that it's the opposite.
Right.
It causes asthma flare-ups, but this is a treatment that they believe worked back then.
Oh my God.
So that's all I can tell you. Okay, number three. Mrs. Winslow's soothing syrup was a popular remedy for babies experiencing anything from teething to diarrhea. So what were the secret ingredients in these 25-cent cure-alls? It was a heavy percentage of what?
I'm going to guess a heavy percentage of honey.
Of honey. I like that. That's probably effective. Again, AJ, you're thinking
too logically.
You're not crazy enough here. The answer is a heavy percentage of alcohol and morphine.
No.
They were later given the label of baby killers.
Wow.
And in this article, it said, if you value your children's health and life, never use any of these preparations.
Yep, don't do that. Also, don't give your babies honey. That is a very bad idea.
Oh, is it? Why is that?
There is a bacteria called I can't remember the name of the bacteria, but it causes botulism. There's basically a toxin produced by this bacteria called botulinum toxin that babies can't digest, and it will cause paralysis in these babies.
Oh my God.
Floppy baby syndrome.
Oh, that's the lesson learned from this podcast. Thank you for passing that along. All right, here we go. Number 4. Many believed that allergy symptoms caused by pollen, we know it as hay fever, could be alleviated with the application of what? What drug would you take for hay fever back then? And it seemed like that was the answer for everything back in the olden days.
Right. Is it going to be bloodletting on this time?
No.
No? Okay.
No bloodletting.
Okay. Crazy.
Oh, you're having hay fever? Here, try some of this white powder. This should help.
Let's try cocaine or morphine.
Cocaine. That is exactly right.
All right.
It cures hay fever. Nice job, AJ. You're on the board.
There we go.
Yeah, I'm not paying for med school, but we got close there. In 1899, there was a hotel in Australia where you could go for rheumatoid arthritis treatment. This hotel was on the beach. What special treatment would you receive?
Oh man.
This one is bonkers.
It's either going to be like a spider bite or like a kick in the gut from like a kangaroo. One of those two things.
Kick in the gut is actually a great idea. No, it was in this treatment, whenever a nearby whale died, patients would be rowed to the whale. The whale would be cut up, a narrow hole would be made in the body, and the patient would lay down in the carcass for around 2 hours. And this process allegedly relieved soreness and inflammation. It was called the Whale Hotel.
Interesting.
Yeah.
Like it actually relieved symptoms, it said?
It said it was allegedly relieved soreness and inflammation. Yeah, allegedly. Right. Okay, this is insanity. Okay, number 6. What kind of enemas were considered a successful treatment for cholera and were recommended as an alternative remedy to opium? So opium was used, but then they said, no, opium is not working. This kind of enema works better. And I'll give you a hint. It's an allusion to something we said earlier. Another crazy remedy.
Is it going to be a milk enema?
No.
No? Okay. That'd be pretty crazy.
No, it is a tobacco smoke enema.
Tobacco smoke enema?
Yep. They would put a pint of boiling tobacco-infused water, and they would administer it into the intestines. And it was reported that, quote, hundreds of lives might have been spared by the tobacco enema.
Might.
Right. Okay. Yeah, these are hard to believe, right? Are these aren't covered in your studies? I'm surprised by this.
Believe it or not, they try to leave that stuff out.
All right, we have 2 more. During Victorian times, people came up with a radical solution to reduce weight. What was it? I'm having trouble with my weight. Well, here's something that will help you to lose weight.
Is it swallowing stones?
Swallowing stones. Talk me through that. How would swallowing stones help? I like the idea.
Well, you're going to
filling the space.
Yeah, filling the space. You're going to get rid of the hunger pangs by having something in there, but you're not going to get any nutritional value there.
You know, they needed you back in Victorian times because instead they were using tapeworms.
Oh, that's right.
Yeah, the idea behind it was that a person would consume a tapeworm egg.
Yeah.
So then the parasite hatches, grows inside your intestines, and it starts to feed off of whatever you're eating. Yeah.
It works, but like at a cost.
It works at quite the cost. That's right.
Yeah.
All right, and here we go. This is the final one. I have a feeling you're not going to get this one.
Probably not.
Ancient Egyptians were really creative with the methods that they used to prevent unwanted pregnancies. One of their notoriously inventive methods was inserting what into the woman?
You know what? I actually knew this at some point in time, but I can't remember for the life of me. So, oh God, what did they have back in ancient Egypt?
Ancient Egypt, they would collect some of this, maybe down at the zoo. I'm sure they had zoos.
Oh, did they put dung up there?
Yes, crocodile dung.
Really? Oh my goodness.
Now, it's unclear whether this method actually worked, but it was obvious now to us how unhygienic and dangerous it was.
Oh, yeah.
I think this is a great ending point. Do you think there's a treatment now that we're doing that in 100 years we'll look back and say, what were we thinking?
Ooh. Yes, I can't think of one as of right now, and I don't want to say something falsely right now that are going to give people the wrong idea. So I'll wait for that. I will say
like shock therapy, maybe? Or if we stop doing that?
Shock therapy actually works in some instances. There are some forms of like real severe depression that are treated by shock therapy. Normally it's done under general anesthesia, but like not while people are awake. Yeah.
Well, I'm going to come back to you in 100 years, and we'll see. We'll look back on this.
I will say that the amount of sugar that we put in things, I think people in 100 years will be like, they are killing themselves. How do they not see this?
Yeah, that's fascinating. I mean, we sort of can get a sense of that now, but it's hard to give that up. But you're right.
Yeah.
Sugar. So, well, AJ, what a pleasure talking to you.
Pleasure talking to you too.
This was great fun. I learned a little bit about the medical world, and hopefully you learn how not to help your patients in the future.
Yep. Best part of medicine is eliminating the things that don't work. So I think I checked those things off.
I've been effective in that area. Thank you, AJ.
Thank you.
I am so grateful that AJ came on the show to talk about Peter Attia, because that is a podcast that I would not normally listen to. I'm not sure I would have ever discovered it had I not talked to AJ. It's not one that would have been recommended based on podcasts that I listen to. So thank you, AJ. It is a great podcast. It's informative. I'm certainly interested in the subject, and now I have something for long road trips, and I always seem to be in my car, so I'm going to make sure that that one is favorited. As for you out there, if you have a favorite podcast that you're passionate about, and one that maybe isn't among the top 10 as far as popular, one that people have probably never heard of, and you don't understand why more people aren't listening to it, then come on the show. Reach out to me at Podfulness on Twitter, at Podfulness on Instagram, and you can always reach me via Gmail, podfulness@gmail.com. That wraps up another episode. As always, thank you very much for listening, and I will catch you next time on another episode of
Podfulness.